You are about to listen to the Dr. Daliah Show. Sassy, stimulating medical talk radio. Any medical advice Dr. Daliah Wax gives on her show should not be substituted for an actual visit to your medical provider. And now, here's Dr. Daliah.
Dr. Daliah Show. Thank you all for tuning in. 1-877 Dr. Daliah, 1-877 DOCDALI. Well, we're coming up on flu season. What I love is now we could get our flu shots at pharmacies. Like I could walk into CVS, get my flu shot and get vaccinated, and it's actually pretty easy for me to go and get that done. And flu is serious. Last year, CDC reported 82 million flu cases in the U.S. with 1.3 million requiring hospitalization. Flu can put us at risk for heart disease, for pneumonia, for stroke. And so we really want to be proactive. A recent study by CVS Health indicates that more than 60% of people intend to get the flu shot this year, but a similar percentage to last year, although only 48% follow through. And so I'm really, really excited about our next guest. CVS pharmacist and district leader Victoria Epper-Jesse joins us to share the importance of how to kind of close that gap and protect ourselves and our families this flu season. Welcome, Victoria. Thank you so much for joining us.
Thank you for having me, Dr. Daliah. Really appreciate it.
Wow. Well, I love that you're all about prevention and you're here to help. So talk to us about flu season coming up and where we should start to prepare.
Yeah, of course, that fall chill is in the air. Kids are back at school. Football's back on the TV. And I know we're all knee-deep in to-do lists, but now's a really good time to start researching prevention as far as it comes to those flu germs and viruses, because those are coming ready or not. So, as we're stocking up on vitamin C and maybe fever reducers to prepare, it's really important to start thinking about the flu shot, if it's right for you and your family, and if so, making an appointment and getting everybody protected.
Exactly. Yeah. And, we have, the inactivated flu vaccine. We have adjuvants for older individuals. Talk to us about who should get vaccinated and what we have in terms of vaccinations for them.
Absolutely. So the CDC does recommend anybody 6 months of age or older to get vaccinated and protected against the flu. Of course, we have those high-risk populations. So the younger population who maybe can't get vaccinated or are still building their immune system. And then our older population, as we age, our immune system does start to decline. So for anybody over the age of 65, we actually have a high dose flu vaccine for them to make sure that they're protected and it works with their immune system as well. And then, of course, anybody with any sort of respiratory diseases that may lower their immune system, anybody going through cancer treatment, anything along those lines, those are really our special populations. But it's important for everybody to get it because it also prevents not only you from getting it, but passing it to your loved ones or passing it to people in those special populations.
Exactly. And now's a great time. I know some individuals say, wow, I could get my shot early August. Should I do it then? Whenever you're comfortable getting it done, I support that. But I think this week is ideal. What about you? When do you recommend people get vaccinated?
I agree. Really, September into October, it does take 2 weeks to reach efficacy. I will say, last year I actually traveled abroad in early September. So I did get it in August in anticipation of that travel. So, if you have anything big going on, whether you're traveling or, visiting family or visiting one of those special populations that we mentioned, you can always get it earlier than September. But right now is a great time. So end of September, early October, before peak season and before those fall holidays really pick up and we're all joined together celebrating different things.
Mm-hmm. And this is a yearly, this is something we do need to do yearly. Even if you got your flu shot last year, this is developed for the newer strains, what's anticipated this year. So this is something that should be done yearly.
Yes, absolutely. Getting it yearly just ensures that you're protected against the most active strain that season, and it does change every year, and we do our best to get that right in creating that vaccine. So getting it yearly, keeps you the safest.
And the safety and efficacy has been pretty well established. It's an inactivated flu shot, and so many people will kind of read up on these myths and these misconceptions of, oh, no, I'm going to get the flu. You can't get the flu from the inactivated flu shot.
Absolutely. You cannot get the flu from the inactivated flu shot. If I had $1 for every time I said it, I'd be retired by now. But I love educating on that. I think where that misconception really comes in is sometimes when you get your flu shot, some people will experience flu-like side effects after for about 24 to 48 hours. But that's really just their immune system doing what we want it to do. It's creating, a response to the vaccine. Those symptoms should be mild. They go away on their own. They're quick. But actually getting those side effects, low-grade fever, maybe some body aches, it's actually a good sign that you're going to be protected from the flu that year.
Mm-hmm. And it takes a couple weeks to kick. How long does the shot take to take effect?
It takes 2 full weeks. So, a mistake a lot of people tend to make is they wait until there's an outbreak in their school or their kids' school or their community, whatever the case may be, and then they go get it. And we don't like to say too little, too late, but it is a little too late. We still recommend you getting it, but, it's not going to be the same level of protection had you have gotten it prior to peak.
One thing that I love is my insurance covers it. I don't have to pay out of pocket. Talk to us about some of the insurance coverage.
Yeah, so it is free with most commercial insurance plans. Also Medicare Part B. If you're uninsured, of course, visit your local health department's website. Sometimes there are clinics that pop up that, you can go get it for free. Sometimes, maybe at a farmer's market or a football game. So, always stay close to those local things. But if you're uninsured, there's also different discount cards and things that can be explored. So just talk to your local healthcare professional. They'll help you find, if it's not free to you, which is rare, find the lowest cost possible option.
That's wonderful. That's wonderful. So where do you recommend people go and how to schedule an appointment?
So we'd love to take care of you at CVS, cvs.com. You can schedule an appointment also through our app. You can also schedule for your whole family at one time because, we want to make it convenient for you. Our minute clinics inside of Target, inside of Schnucks, if you have Schnucks in your area. But, if CVS isn't the right fit for you to get protected, we ultimately just want you to get protected. So call your doctor's office and check those local health department websites to understand where clinics will be popping up for you.
Love that. Love that. You have been so helpful. We're speaking to CVS pharmacist and district leader Victoria Epper-Jesse. One more time, where can my listeners find more information?
CVS.com, or for more information just on the flu itself, cdc.gov.
Oh, wonderful. Well, thank you so much, and we can't wait to have you back.
Thank you. Thank you for having me.
All right, guys, don't go away. 1-877-DOC-DOLLY. Hi, guys. Dr. Daliah here. Addictions can sneak up on us and come in many forms, whether it's drugs, alcohol, sex, video games, porn, or something less obvious, such as food, internet, or shopping. Addiction can seem innocent at first and then evolve into an insurmountable evil. In our book, Addiction Basics, Caitlin Kalikas and I dive into the common addictions and provide tips for identifying and preventing these before they sneak in and take over our lives. Addiction Basics can be found on Amazon or my website, drdaliah.com. Check it out.
Carl Amari here to tell you about our newest website for old-time radio lovers. It's 100radioshows.com. At this site, there are 5 old-time radio shows waiting for you to download free as our gift to you, and be sure to browse the additional 700 old-time radio shows available to you for 70% off by using the promo code RADIO at checkout. This is a limited-time offer, so log on to 100radioshows.com. That's 100radioshows.com.
Let's face it, guys, we're living in times where the truth is becoming more suppressed and censorship is increasing at an alarming rate, especially on social media platforms. It's Clyde, and I want to tell you about a safe and secure digital playground we put together just for you. It's aftermath.media. You get access to thousands of Ground Zero archives and podcasts, along with our private social media groups with your basic membership starting at only $7 a month. Each subscription includes tech support, access to the RSS feeds, along with our own chat room and Telegram channel. In addition, the premium membership includes research study groups, webinars, a document and movie library, a live video stream of Ground Zero, a monthly Zoom chat with me, and other bonus content. Be sure to check out our yearly specials as well. Sign up today while you're thinking about it. Sign up at aftermath.media. Again, that's aftermath.media.
We are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-Dr. 1-877-DOCDALI. Big thanks to Talk Media Network for making the show happen. Big thanks to Daniel, our producer, and big thanks to y'all for tuning in. We really do appreciate it. Don't forget to follow us on Twitter or X at Dr. Daliah, Facebook, The Dr. Daliah Show, and on YouTube. Click like and subscribe. So last year I talked to you guys about how I get a lot of patients that'll call in brain fog, fatigue, itching, headaches, diarrhea. And I don't always screen for indolent systemic mastocytosis. And it's a rare disease, but it's probably one of the most commonly missed diseases. And so I am really excited about our next guest. We have Jackie, a retired nurse with indolent systemic mastocytosis, as well as Dr. Doreen Siri, an allergist and immunologist, to talk to us about what this is and what to look for. Jackie, we are so grateful, you and Dr. Siri, to come on. I'm going to start with you. Can you talk to us about your journey with indolent systemic mastocytosis? What were, some of the symptoms you experienced, and how your doctor concluded that that's what was going on?
Certainly. I started having symptoms back in the 1990s when I was working as a nurse. I had migraine headaches, an itchy rash on my neck and my chest. I had stomach problems. I had GI problems, a lot of diarrhea. I had a lot of itchiness all over my body. I would have blood blisters the size of marbles in my mouth. It was just a messy situation. And I brushed those symptoms back and just thought it was the stress of my job until the symptoms did not go away. And that's when I started seeking medical help. And I went to many, many doctors who didn't have a good grip on it or didn't understand it. And finally, in 2014, I was diagnosed with ISM after a bone marrow biopsy and a blood test. So it took almost 25 years to get there.
Wow. Dr. Siri, talk to us about ISM and how it impacts patients.
It's an absolute pleasure to be here to talk to you about ISM. This is obviously in partnership with Blueprint Medicine that manufactures, of course, AYVAKIT to treat it. Simply put, ISM, you've touched on a lot of those points already. It is patients who have these constellation of symptoms. They have brain fog, they have a weird skin rash, they have allergic type symptoms like anaphylaxis, hives, flushing. They don't know what's going on, but it's certainly out of proportion to a regular allergy patient. They may even think they have new onset food allergies to multiple foods, and now they feel like they're sensitive to a bunch of chemicals and smells, and so really, really debilitating to some patients. Simply put, it is an overactive immune system. The mast cell, M-A-S-T cell, a regular, as you know, immune cell in our bodies, a white cell that now genetically mutated and is manufacturing day and night, and now we have too many mast cells, and they invade the skin, the gut, the nervous system, and that's why we have these symptoms. And we all know that mast cells are responsible for allergies as well, so that's why people think they're having allergic reactions, because there's just way too much histamine and other chemicals now being produced from these mast cells.
Many patients, they struggle to have a primary care provider. Some insurances allow them to go straight to a specialist, and patients will call up, because I work for a telemedicine company, going, where should I go? Should I go to an allergist? Should I go to a dermatologist? Because so many primary care providers are not necessarily trained, and having a grip, as Jackie said on this, which specialist do you recommend that they see? The allergist, immunologist, dermatologist, hematologist? Who would you recommend they start with?
I think that really depends on the symptom that they're actually having the worst. So many patients end up seeing a dermatologist if they have a skin rash. But like you and I, there are a lot of patients who basically present to us like they don't have a rash. So you and I take care of these patients who don't have a rash, but they have these other symptoms, like weird allergies. So in that case, I think an allergist immunologist is definitely appropriate, or even just family medicine primary care saying, hey, these allergies are out of proportion to what I really think is going on. Maybe a blood test is run. I don't really have that many allergies. What's going on? Let's see if I can get a referral.
Exactly. And now we have a fantastic treatment for that. Talk to us about the treatment.
Yes. Is it okay if I start, Jackie?
Yes.
So the treatment is something called AYVAKIT. It is not an antihistamine. It's not something you get over the counter. It's the first and only FDA-approved medication for the treatment of indolent systemic mastocytosis. It is a precision medicine. It specifically targets that gene mutation that occurs in most people with the indolent form of systemic mastocytosis, so it interrupts the manufacture of those mast cells. So in clinical trials, of course, we saw a decreased burden of mast cells, but also those symptoms. 50% reduction or more of brain fog, skin symptoms, gut symptoms, allergic type symptoms, so really helpful.
That's fantastic. And Jackie has experience with it. Talk to us, Jackie, about how the treatment has gone.
I started taking AYVAKIT 2 years ago, just after it was approved by the FDA for ISM treatment. And I had a chat with my doctor about it before I started it, and he told me about the possible side effects and what I could expect. And yes, I did have some side effects, but they only lasted maybe 3 weeks. And then my symptoms that I had carried with me for years started going away, and within about 6 months, about 80% of the symptoms were gone.
Wow. It's interesting because a lot of us will just live with the symptoms and we struggle, and we're obviously we want to use a drug that's safe. We want a drug with minimal side effects, but I have patients who suffer from various illnesses, and they struggle so much that they're struggling more than what a side effect could be. And so you really have to have that balance. And so can I ask what side effects you had that were transient?
Yes. I became very short of breath, and I had trouble standing up straight, very fatigued, and I had brain fog.
Now, how's your functioning now? How do you feel now?
Great. Those symptoms went away within about 3 weeks.
Wow. Wonderful. Dr. Siri, so, this therapy is a great option. What do you recommend for patients who have ISM and these symptoms?
Yes, absolutely. Of course, the first step is diagnosis. It's a simple blood test, which is a blood spot. It doesn't even require a whole tube of blood. So blood spot test. And if they meet criteria, then we go on to do a bone marrow biopsy. And in those patients, if they're taking baseline usual medications for their symptoms, not getting relief, then AYVAKIT would be appropriate. And these symptoms, side effects that Jackie had, the most common are swelling around the eyes, swelling in the extremities. We don't give it to patients who have really low platelets, but otherwise it's been really well tolerated in my patients as well. And it does have to be monitored by a physician, whether it's you or me or someone pretty closely.
I agree with that. It is easily tolerated.
Love it. Jackie, any other advice you have for patients who are struggling like you had?
Absolutely. Number one, you're not alone. There are many people available to help you. You just have to find the right group of people to do that. Search for a physician who is willing to listen to you and validates what you have to say. Secondly, understand the illness. Go online, Google ISM, and learn at your own pace. There are several support groups out there. Perhaps you could join one of those, or just go on one of the sites and read what they have to say. And thirdly, never give up.
Jackie, thank you so much for coming on. Dr. Siri, where can my viewers go for more information?
Absolutely. You can go to ayvakit.com. That's AYVAKIT.com. There's general information about ISM. There's information about the medication, and certainly other resources like, Mast Cell Society is really helpful for kind of the general public as well.
Dr. Doreen Siri, Jackie, thank you so much. Thank you for coming on. We really, really appreciate it, and we can't wait to have you back.
Thank you so much.
Thank you.
1-877-Dr. Dolly, 1-877-DOCDALI. Another take-home message from this is if you don't think your doctor is listening, and it could just be they haven't been trained in shall we say ISM, or don't give up. If you think something's wrong, get yourself checked out, and sometimes it takes seeing a specialist if you need to. 1-877-Dr. Dolly. Don't go away.
At Hot Shot Secret, we share the science behind common diesel problems and their solutions. For example,
Diesel fuel cetane levels.
in many states, the cetane rating in diesel fuel is 42 to 45. Most diesel engines operate more efficiently with a cetane rating of 48 to 50. One treatment of Hot Shot Secret Diesel Extreme will raise your cetane 7 points, increase fuel economy, and improve cold starts. Due to a cleaner burn, there are less hydrocarbons and particulate matter in your exhaust. This reduces the blockage of your diesel particulate filter. Using Diesel Extreme generates 83% less DPF regeneration. The 6-in-1 Diesel Extreme formula also includes the most concentrated detergent on the market, lubricity enhancer, water demulsifier, rust and corrosion inhibitors, and a fuel stabilizer.
Hot Shot Secret Diesel Extreme is available nationwide at truck stops, fine farm and auto stores, and online at hotshotsecret.com.
Hot Shot Secret, powered by science.
We are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-Dr. Dolly, 1-877-DOCDALI. So there's been a variety of statistics looking at cancer. When I was in medical school, we were taught that 1 in 2 people will get some sort of cancer in their life, even if it's a benign tumor. American Cancer Society says 1 in 3 Americans face a risk of cancer diagnosis in their lifetime. And in my family, breast cancer is common. Breast cancer affects 1 in 8 of us. But I got to tell you, the people surviving breast cancer are sharing their story, reaching out, and saving lives. And one such person I'm so excited to have is Broadway actress, cancer survivor, and advocate, social media influencer, Sarah Bentley. She is teaming up with AFLAC to launch a new campaign called Checked for Cancer, with the goal of increasing early cancer screenings by 10% over the next decade. As you know, Sarah Bentley is a Broadway actress and co-founder of A Chance for Life. A Chance for Life is a nonprofit that funds surrogacy for breast cancer survivors. Wow. Sarah, we are so excited to have you. Welcome to the show.
Oh my gosh, thank you, Dr. Daliah. I'm thrilled to be here to share my story and to tell you a little bit more about this amazing campaign with AFLAC.
Yeah, and it's not easy. I mean, you were diagnosed with stage 2 breast cancer. You were only 38 years old. And, that's very traumatizing. And here you are, willing to share, your cancer journey. Talk to us about that.
Yeah, I mean, my story is my superpower, right? And by telling it, I hope to reach at least one of your listeners. I had an itch underneath my armpit. I went down to scratch it, and I found a lump the size of a walnut. And my doctors, they brushed it. They didn't think it was anything serious, but I know my body so well, as a professional dancer and a yogi, and I just knew something wasn't right. So I advocated fiercely for more tests, and eventually, after multiple biopsies, I was diagnosed with stage 2 breast cancer. And, that's why I've teamed up with AFLAC on the Check for Cancer campaign, because of my advocacy for myself and my own health, I saved my own life. And I want to help others do the same. I mean, early detection, it really matters.
So true. And I can't tell you how many times patients feel intimidated by their medical provider because they say, no, you're too young. Or, no, it's nothing. In fact, we opened the show talking about itching and how sometimes an itch is a sign that you could have something underlying. So it's just so telling that these are the ways your body, like you said, your body, and so thank God it was caught at stage 2. And so how did your treatment go and your recovery?
Yeah, I thank God every day for that itch, Dr. Daliah. I'm telling you. Thank you, itch. But yeah, I was diagnosed at stage 2, which is considered early stage breast cancer. And there's no easy stage of breast cancer. I mean, this rocked my life and changed the entire course of it. However, the most important thing I want everyone to hear is that because it was caught early, it was treatable, right? And this is why AFLAC is here to talk about this Check for Cancer campaign with myself, because they're like a lot more than just an insurance company, and a lot of people don't know that, but they're pioneers when it comes to cancer insurance. So raising awareness through this campaign together, we hope to increase cancer screenings by 10% in the next 10 years. It's such an important message.
Love it, love it. So talk to us about Check for Cancer.
Yeah. All right, this is a wild stat. Are you ready? AFLAC did a study showing that 60% of people skip their routine medical exams and screenings. Yet we know that early detection can boost survival rates above 90%. And that's why we're here with this movement. And we want to make it very simple for everyone, right? So checkered patterns, a chessboard, a checkered flag, a checkered pair of sneakers. Anytime you see a check, you're reminded to get checked. And not only that, but the social, it's so great, right? I mean, it's so obvious. It's right in front of you. There's checkers everywhere. And the social media component is that every time you post using hashtag Check for Cancer, AFLAC contributes $5 to childhood cancer care and research up to $1 million. Yeah.
Wow. Yeah, I'm doing my mammogram in November, and we got Breast Cancer Awareness Month coming up. We have so absolutely hashtag Check for Cancer, because you're helping save children's lives and adults' lives with reminding them of such a great campaign. We're speaking with Broadway actress, cancer survivor, and advocate social media influencer Sarah Bentley. So 60% of people avoid routine health checkups from the AFLAC survey. So, we think we know why, but how do you, I know as a doctor, but that's kind of intimidating. How do you send that message, resonate that message to those individuals who are apprehensive about going and getting checked?
Yeah, when I felt that lump, I already was terrified, right? What could it be? What could they tell me? If I go to get checked, what if they tell me it's cancer? And I almost stopped at the front door of the radiologist's office because of that fear. And I took a deep breath and I said, knowledge is power. Because you know what's scarier? Not knowing. And if I wouldn't have gotten those tests, my doctor said my cancer was so aggressive, I could have been stage 4 if I would have waited just a few more months. And this is what I want you to walk away with. The data on early detection is all around us. It's everywhere. With early detection, most cancers are far more treatable, right? So don't wait. Take a deep breath and know knowledge is your power.
So true. So what's next for you in your career?
Yeah, speaking of power, my story is my superpower, so I'm going to continue to tell it wherever people will hear it, through this campaign with AFLAC Check for Cancer, and through my advocacy for all cancer survivors and people going through it, as well as with my nonprofit. We raise money to give full surrogacy journeys to breast cancer survivors. As a new mama, I'm a mama of a 20-month-old baby boy, brought here via surrogacy. I got my chance. His name is Chance. After breast cancer, and I want to have women be able to have their chance too.
Oh my gosh! Well, you are. I had a friend of mine that had stage 3 cervical cancer, and she was like, "How could this happen to me?" And she survived it. And I go, sometimes I feel this is God's way or nature's way of protecting others by people such as yourself with such enthusiasm and passion, for other people, to save lives. And so, it's a shame you had to go through what you went through, but you're turning it into something good. And God bless you for that. I really appreciate what you and AFLAC are doing.
Well, thank you, Dr. Daliah. Yeah, that's why, teaming up with Aflac, who is just as passionate as I am about helping people have the right kind of information to know that checking for cancer is giving you a leg up on anything that could be happening in your body is a very, it's what I aim to do. So I want to let you guys know, though, if you want to have any more information on this campaign, there's so much more to talk about. Aflac.com/check-for-cancer. All of the resources are there, screening checklists, employers, toolkits, and just all the good ways to get proactive about your own health.
Absolutely. Thank you. I was going to ask where to get more information. One more time, if you could give us the website.
Yes. Get your pens out. Aflac.com/check-for-cancer.
Wonderful. #check-for-cancer. Love you, Sarah, so much. Can't wait to have you back. Thank you and Aflac for all you do.
Thank you, Dr. Daliah.
Anytime. 1-877-DOC-DALI, 1-877-DOC-DALI. So when I had my breast cancer scare, I was, because I had blood coming from one side, one breast, and that's never anything good. And I'm sitting there waiting for my mammogram and for my biopsy, and I'm hearing people giggle, in the back of the doctor's office and things. And I'm just thinking to myself, going, gosh, why can't I be like them? Why can't I, why can't I, ignorance is bliss sort of thing. But I got to tell you, catching something early and getting ahead of it is actually the blessing. And so, I understand it's intimidating to go and get checked out. I get it. It's not easy. I hate going to the doctor, and I am a doctor. But get yourself checked out. 1-877-DOC-DALI. Don't go away. Dr. Daliah here. Are you tired, burned out, gaining weight, succumbing to the daily pressures of life? Well, how's your dopamine doing? How you feel right now, how you'll feel an hour from now, and how you'll feel next week is completely reliant on your dopamine. Our daily motivation and willingness to push through challenges depends on the intricate chemical process dopamine provides. Christian Kalikas and I created Deploying Dopamine, a book that tells you what dopamine is, when it dysfunctions, and how to successfully deploy it when needed. Find Deploying Dopamine on Amazon today. Check it out.
Have you ever thought you'd like to buy and sell houses but didn't know how or where to get the money? My name is Ron LeGrand, and over the past 40 years, I've bought over 3,000 houses without using my money or credit and taught thousands to do the same. Today, even in a virtual environment, we buy nice houses in nice neighborhoods using no banks, realtors, contractors, or other costly entanglements, and build huge cash flow and wealth without the hassle of tenants, all without credit and little or no money. You don't need a license or experience, and I'll show you exactly how it's done. Text FREE to 99799, and I'll send you my free training. I promise you I'll change the way you think about real estate and open the door to a new lifestyle that doesn't involve risk or rehabs and can quickly replace your current income. Text FREE to 99799, and let me show you how to take your life back and build cash flow and wealth from your home. That's FREE to 99799. Again, FREE to 99799.
As an organ donor, your story doesn't have to end. The good in you can live on. In fact, you could save up to 8 lives and restore sight and health for many more. Sign up right now online as an organ, eye, and tissue donor. You'll be happy you did. And just maybe, someone else will be happy too. Go to organdonor.gov. It saves lives. U.S. Department of Health and Human Services, Health Resources and Services Administration.
We are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-DOC-DALI, 1-877-DOC-DALI. Big thanks to Talk Media Network for making the show happen. Big thanks to Daniel, our producer. And big thanks to y'all for tuning in. We really do appreciate it. Don't forget to follow us on Twitter or X at Dr. Daliah, Facebook, The Dr. Daliah Show, and on YouTube, click like and subscribe. So I had a family member who had woken up one day started brushing his teeth, and he was bleeding a lot when he was brushing his teeth. And he's like, well, that's odd. I've been taking care of my gums. Maybe I brushed too hard or dental floss too hard. Well, he didn't think much of it, went to work a few hours later, and then he began to have a nosebleed. And his colleagues said, whoa, you really better get yourself checked out. And he went into something called ITP, idiopathic thrombocytopenia, or immune thrombocytopenia. And he was losing his platelets. And when you lose your platelets or your clotting factors, you could bleed heavily, bleed severely. And sometimes people don't realize this could come on. Some might see a bruise, think of it as a minor inconvenience, but if you do have ITP, that bruising could signal something more serious. It's a rare condition. ITP is rare, but it happens when your immune system mistakenly attacks and destroys your healthy platelets in your blood. 25,000 U.S. adults could benefit from advanced treatment. And we'll talk about this today because September marks National ITP Awareness Month. This allows us to talk about ITP, understand what this could go through, what your loved ones could go through, and how the condition could significantly impact your quality of life. But we have treatments that could address this. What's exciting is the U.S. FDA has now approved Wayrils, a novel treatment for adults that have persistent and chronic ITP and who have had an insufficient response to earlier treatments. I'm really, really excited for our next guest, Amit Mehta, a board-certified hematologist and medical oncologist who is going to talk about how she treats people with ITP and this new treatment. Dr. Mehta, thank you so much for joining us.
Good morning. Thanks very much for having me.
So what is ITP and what are some of the most common symptoms?
Yes, so ITP, or what stands for immune thrombocytopenic purpura, is a serious blood disorder where one of the main cells in the human bloodstream called the platelet cells can go down to very low or even dangerous levels. The platelet cells normally are involved with helping a person or protecting a person from bleeding and bruising. So therefore, if it goes down too low, you can imagine somebody could be at risk for dangerous or serious bleeding or bruising. In addition, other things can happen also. So for example, people can have other symptoms with the condition ITP, such as fatigue, stress, anxiety, things that are part and parcel of the condition as a whole, even beyond the bleeding and bruising.
Why is National ITP Awareness Month so important?
So first of all, thanks for mentioning it. Coincidentally, September is National ITP Awareness Month, which I feel as a physician is great in terms of these awareness months, bringing attention in a positive way for patients to get attention to therapies, people that don't even have a diagnosis yet and are looking for answers, as well as fueling future research efforts to help people get better therapies in the future, more advancements, and those kind of things that can help patients with ITP around the country.
Tell us about the new treatment for ITP and what makes it so unique.
Yes, thanks for bringing it up. And first of all, fundamentally, ITP, it has been a complex condition to treat. So I'm very happy to be here on behalf of Sanofi as a spokesperson, as just recently there's been a new therapy approved by the FDA of the United States called Wayrils, W-A-Y-R-I-L-Z is how you spell it. But basically, this is a treatment that works directly to inhibit or counteract the main abnormalities inside cells that cause ITP. So this particular pathway is called the BTK pathway, and this particular pathway is directly counteracted by Wayrils therapy. So this pill has been studied in large clinical trials, of course, and what they looked at in clinical trials and they found is that when people get Wayrils therapy, there can be rapid and sustained platelet count improvement by receiving Wayrils therapy. In addition to other things were also looked at within clinical studies, like effects on other symptoms people can have with the condition, like the ones we talked about earlier.
What else should my listeners know about this treatment option?
So besides the possible platelet count improvements, there are also common side effects like any medication that one should be aware of and what physicians will help patients monitor. So some of these common side effects include nausea, abdominal pain, headache, diarrhea. We also have to monitor for signs of infection, including serious infection. Also monitoring for liver problems to make sure that we're checking the right liver function test to ensure there's not a liver problem developing. Furthermore, if there's women of childbearing age who are taking this medication potentially, then effective contraception needs to be used while on treatment and for at least 1 week after the final dose of Wayrills or completion of Wayrills. And before starting therapy, pregnancy status should be checked also for women of childbearing age. And lastly, like any therapy, remember that one has to talk to their physician if it's right for their particular case. Wayrills may not be right for every ITP patient out there, so talk to your physician to determine what may be the best strategy for your individual case.
I am so glad you came on. This was so helpful. Where can my listeners go for more information?
Yeah, so patients who are looking for more information can easily go online to wayrills.com. WAYRILZ.com is how you spell it. And you can find more information, including the full United States prescribing information from the FDA as well. So that's easily accessible online.
Thank you so much. Thank you for coming on. We really, really appreciate it. And we can't wait to have you back.
Thanks very much for having me.
So I really can't stand wearing glasses. I have been in glasses since the 6th grade. And I was jealous that my brothers didn't have to wear glasses. My dad didn't have to wear glasses until, of course, he needed reading glasses. And I just, wanted it was difficult to do sports. I couldn't stand wearing glasses. And my parents wouldn't let me wear contacts because they were anti-contact, so I couldn't get contacts until I moved out of the house when I was 18. But I still didn't get contacts because I couldn't afford them at the time. And I just didn't wear my glasses. And I didn't necessarily have to wear glasses all the time. I was nearsighted, meaning I could see things up close. But if something was far away, then I needed to use glasses. So to see the board, to watch TV, maybe to drive. And now I did the best I could until I'm in medical school. And the contacts were really starting to bother my eyes. I started to develop something called giant cell or a giant papillary conjunctivitis, GPC. And this GPC was, in a way, my eyelash or my eyelid growing tissue away from the cornea to protect itself from the contact lens. My eye was starting to just really bother me. And so what I ended up doing is getting LASIK. And LASIK reforms your cornea. And it's a refractive surgery to reshape the cornea so that your images aren't then nearsighted or farsighted. How nearsighted and farsighted happens is it depends on how the image comes in through the lens and hits your retina. Your image is supposed to hit the retina perfectly, and then it's clear. But if it doesn't, and it hits it too soon, or the image would technically be behind the retina, it's blurred. So the reason why we use glasses or contact lenses is to correct that refraction. And that's how that it's been a science for centuries, and it's worked really well. The problem we're having with some of these procedures is they're not long lasting. For those of you who are older and middle-aged, if you later get cataracts, your new lens can be refracted and give you then perfect vision. Just for those of us too young for cataracts, we have to decide glasses, LASIK, SMILE, this new procedure. Get an exam, talk to your ophthalmologist, and go from there. 1-877-DOC-DALIAH.
Looking for an easy read that can actually help secure someone's future? Pick up a copy of Mark Falter's book, Common Sense Income Strategies. For the past 30-plus years, Mark has helped thousands of hardworking Americans secure their financial future by using strategies that continue to create wealth, whether the market is up or down. Strategies that will make perfect sense once you take the time to read this powerful book. Common Sense Income Strategies brings to you what Mark has been teaching in person and talking about on the radio for decades. It's not rocket science, it's a pretty easy read. You've worked too long and too hard not to see the fruits of your labor. Common Sense Income Strategies is available now on Amazon or by calling 866-764-2635. That's 866-764-2635. Common Sense Income Strategies by financial fitness show host Mark Falter. Secure your financial future today.